Good afternoon, everyone. Thank you so much for joining us in today's afternoon breakout session, Communication Strategies for Flu Vaccination. My name is Latasha Hinkson-Callis. I will be the moderator for this session this afternoon, and we have a great panel of speakers lined up for you. I wanted to begin by just giving an overview of the session. It's going to provide an overview of statewide and national efforts to promote flu vaccination using multi-partner communication campaigns such as Vaccinate Texas and the CDC-funded initiative, the National Influenza Vaccination Disparities Partnership. Participants will learn about best practices for partnership development and sustainability strategies. So I'll begin actually by presenting two speakers at a time and reading their bios. They're going to do a little tag team, and then once they complete, I'll go ahead and introduce the next speaker. Dr. Chhadua is a district pharmacy supervisor for Walgreens Company, the nationwide drugstore chain headquartered in Deerfield, Illinois. He's responsible for leading Walgreens pharmacy operations for 45 locations in the Dallas North Market. Dr. Chhadua joined Walgreens in 1997 as a front cashier. During his tenure, he has held various leadership positions, ascending from intern, pharmacist, and pharmacy manager to pharmacy supervisor in multiple areas throughout the DFW area. In 2007, as the Walgreens immunization leader for North Central and West Texas, Dr. Chhadua was instrumental in transforming each of Walgreens' 310 stores in these areas into immunization centers of excellence and seamlessly executed a program to provide immunization training and certification to the 675 pharmacists working in these stores. Dr. Chhadua presently serves as the Texas Pharmacy Association's Treasurer-elect for 2014-2015 and continues to work in a professional capacity to improve preventative healthcare access for Texas patients. Dr. Chhadua earned a doctorate in pharmacy from Texas Tech University Health Science Center in 2002. So we welcome Dr. Chhadua. And next we have Kayla Heffington. Ms. Heffington is a district pharmacy supervisor for Walgreens Company, the nationwide drugstore chain headquartered in Deerfield, Illinois. She's responsible for leading Walgreens pharmacy operations for 40 locations in the San Antonio East Market. Ms. Heffington has held numerous leadership positions throughout her career and has practiced in Texas, Georgia, Oklahoma, Illinois, and Arkansas. Very traveled. She joined Walgreens in 2002 and served as pharmacy manager in multiple areas before ascending to her current role. As an immunization leader, Ms. Heffington has been instrumental in establishing and expanding immunization training and programs in Texas, Oklahoma, and Arkansas, as she's proud that she is the pharmacist Let me step back for a second. And she's proud that she and the pharmacist immunizers under her guidance are leading the nation in immunizations and other preventative healthcare services. Ms. Heffington earned a Bachelor of Science in Pharmacy from the University of Texas in Austin in 1996. Hook 'em. And I would just like to welcome them.
So I am from Dallas, I assure you. I had my temperature checked before I got on the plane. When I got off the plane, you guys in the back, don't worry, y'all are all fine. You guys in the front, a little dodgy. All right, so to start off, we do have a disclosure. Yes, we do work for Walgreens, and that's where this pretty much ends. Why you guys are here is, what's Vaccinate Texas? What is this Vaccinate Texas that we've been peddling out there while we've been talking to all you guys out there? Well, I want to first let you know that when we talk about Vaccinate Texas, I do have to speak a little bit and give you my elevator pitch, and that will have a little bit of Walgreens involved in there, okay? So our elevator pitch. Walgreens pharmacists have been administering immunizations for 7 years, and I'll be 100% transparent when I say that this multi-billion-dollar company has worked very hard to ensure that the citizens of Texas know that they have accessibility for their recommended immunizations at every one of our pharmacies. All CDC recommended and required immunizations are available in every single Walgreens location and administered by a licensed Walgreens pharmacist. in the end of 2013, Walgreens did provide over 7 million flu shots nationwide, and a little under 1 million of those flu shots occurred here in the state of Texas. We were only second to the U.S. government on the number of flu shots that we administered. Now I can get my paycheck for today. So, but in all seriousness, that's not enough. 7 million flu shots, it's still not enough. And it actually hasn't been good enough for several years. And like most healthcare providers and healthcare companies, even corporate America has struggled to actually drive the immunization rates and where we would like it to be. And that puts us in the same category when it comes to public healthcare services, physicians groups, hospital systems. And we've seen the same population of people at 18 to 64 demographics year after year avoid the flu shots or avoid any preventative immunizations year after year. So doing this, for now 7 years, we've come through those same hurdles that you guys as healthcare providers see as well in the clinics. We see this on the retail setting. But what is it? What is the avoidance that's occurring here? And we really had to ask ourselves, why is there such a hurdle here, and what can we do to change this? And noodling around on that, we started to understand that with this group, there was, especially when flu season came, there was a key misconception or a lack of information that they were getting bombarded with, either tons of information that was given to them specifically about the flu or the lack of it. So from this is where Vaccinate Texas started. Okay? Now, I will say this campaign started with one team member in Dallas, Texas, the Vaccinate Texas program. That is Miss Kate Turner. You guys have probably heard her name quite a bit, and it started as a pebble. It started where we saw the city of Chicago did a Vaccinate program, and Kate said, that's a small rock. We're in Texas. Okay? We can do it bigger. So we're going to vaccinate the entire state of Texas. That's the feat, and it's doable because everything in Texas, we do it bigger. Well, it needed to include more than people that just shopped our Walgreens locations. Okay? It wasn't enough that we had posters in our stores or even in the retail setting that says flu shots are available. We needed to be able to make sure that was all inclusive, and it affected a change that was larger. Okay? So with that came 2013. 2013 was the launch of our first Vaccinate Texas initiative. And we learned a whole lot what to do and most definitely what not to do. Okay? And so we feel for going into the 2014 period, right now in our second campaign, we feel like we have a good foothold on how this works. Our goals were developed from 2013, and we're moving those forward into 2014. And you can see them listed up, you can see them here listed up above. Our three top priorities are those three top goals. Increased influenza immunization rates throughout Texas as a whole. That's our first goal. And then increased flu awareness, knowledge of potential risk factors, and importance of immunizations. And the third one is enhanced community access to immunization services. Okay? We'll talk a little bit later about that third one, where we feel that's our big win. But those first pieces, we're adamant that if with the Vaccinate Texas program if it was going to make a difference, we had to reach people on all different platforms. It couldn't be just one location. And we wanted to be able to put that message in a way that those individuals who didn't understand the dangers of flu shots were well aware, as well as those individuals that needed to get the flu shot because they had a secondary chronic disease associated with them, that they had all that misconception removed. And to achieve goal number one, which was to increase immunizations rate, we needed to provide people with information so that they could make that informed decision. And we felt that if we could do that through goal number two, okay, increasing the awareness around it, goal number one would come in. It would follow right through. Okay? So I'm going to tell you a little story. In my job, communication is a big piece, is to effectively communicate. And in that piece of effectively communicating, we have to be able to, I got to tell my daughter, and my daughter always asks, Dad, where are you going? And my 4-year-old, whenever she comes up, she goes, I explain it to her, and she'll look at me and she goes, Raj. She calls me Raj when she's trying to make a business point. She gets that from her mom. But she'll go, Raj, it's easy, Dad, it's easy. Just make it simple and make it fun, like cupcakes, okay? Well, this is our cupcake, okay? This is the face of our awareness campaign, to recognize Vaccinate Texas. And the campaign images, again, were created by Walgreens corporate marketing department. And in the end, Walgreens donates the time to create this media platform, as well as to ensure that the image is maintained. That's where it stops. Okay? I want it to be clear that this will be distributed, the files are distributed to any group that's interested in participating in this program. So to just reemphasize it, this is not, nor will it be in the future, a charge to any of our partners to utilize this image. Okay? That's one hurdle that we have to get through. And again, the image was specifically designed to be non-branding, and again, any one individual could put their own logo here. If it's a one individual logo, you can see that at the top, or if it's multiple partnerships, you can put that at the bottom. Now, at this point, we had the idea. We were like, okay, we've got the idea. Now what's next? We got to get a large group. We got to make it a larger platform. We, took this and we said, how do we start to get this to 10,000 individuals? And well, we started to call our partners. We needed help from our friends. And the first group we called and contacted was Health and Human Services. Okay? They've been a great partner and great friend to Walgreens, and they were the first partner when it came to joining this Vaccinate Texas program. Okay? From there, it rolled into, we started to get hospital systems that started rolling in the DFW area. In addition, we also got insurance companies, and then the bigger one was employer groups. Employer groups that didn't fit the traditional healthcare model. It started joining to get this information out to not only their patients as well as to their customer base. The hardest sell here, to be transparent, the hardest part is to convince our partners it's free. Okay, it's free. Kate, we'd get on the phone, we'd start talking to them, we'd go through the pitch, and 2 minutes into it, all right, where's the hook? How much is it going to cost me? No, it's free. Okay? The second hurdle that we had was specifically stating that you're not associated with Walgreens. This is not a partnership with Walgreens. This is a partnership with Vaccinate Texas. This is a platform that you guys can utilize as your own. The only involvement that Walgreens has in theirs is that it was a brainchild that was created out of some Dallas folks that, by chance, work for Walgreens. Okay? Now, our methodology on this is, again, to use the same image, promote the same message at the same time statewide. And the big piece here is to allow us to leverage a single image against all different groups that have a continuous theme. Texans see this image at their doctor's office, their pharmacy, and quite frankly, at a coffee shop if they're going there. The same image across to drive home, get your flu shot. And it's an iconic brand that they can recognize. Now, bigger win on this is that if we increase the flu rate, we get these patients to see their providers, they're going to have tangible conversations with their provider to get those other immunizations that we know this group misses out on. And in the long run, that's the bigger win that we're trying to drive for. And that's the thing that, again, helps with the preventative care in Texas as well as the healthcare spend in Texas. Now, I've gone through that piece right there on specifically about what the big purpose of Vaccinate Texas was. I want to transition this over to my partner, which is, again, Kayla. And Kayla's going to go over through the grassroots efforts and how we can get you guys to participate in this.
Thank you, Raj. So we've got the high-level overview. We know we want to be consistent. We want the same message. We want the same image. Again, those images are free to anyone who would like to use them. And we want to be talking about the same things at the same time to drive that big win, which is ultimately delivering a higher immunization rate within the state of Texas. So you're sitting there. What's this mean to you? And how can you promote Vaccinate Texas if you're interested in joining, which we really hope you are. So let's go through. We want to show you some examples of how some of our current partners are doing so and utilizing Vaccinate Texas within their organizations. So if you're a large hospital system, per se, or perhaps, if you have an outgoing adherence program and you're reaching out to patients after they leave your facility, you're reaching out to them, you're talking to them anyway. So talk about Vaccinate Texas and talk about the needs for immunization for them and their family members and their neighbors. And again, this is a grassroots effort, and we need everybody talking about the importance of immunization. We've shared images of the marketing pieces. You're welcome, again, to use those for free, and you can post those throughout your facility. So you don't have the opportunity to speak one-on-one with every individual that comes into your organization, but just that visual reminder that they're hopefully going to see at multiple partners across the whole Vaccinate Texas program is going to help drive that consistent message. You're welcome to use the images within your own internal organization system, whether it's a newsletter or email system. We want these images used. And again, they're free. It's a big deal, right? And use them for email, and again, just drive. We've talked in multiple presentations today about the importance of social media and how that's really, we are a socially driven society, and so we want these images and this message definitely to be shared through social media sites. I'm not going to read through these specifically individual. It's the same points. Again, the take-home message here is that we have the tools for you to use, and we want you to use them regardless of what type of organization you're affiliated with. We did want to call particular attention to our academic partners in colleges and universities, because when we talk about the 18 to 64-year-old age demographic, we've got perhaps college freshmen that are away from home for the first time ever. And so they don't have mom and dad telling them, hey, go get your flu shot, go get your flu shot, go get your flu shot. So if we can get that image in front of them multiple times, they might not do it the first time, but maybe the second, third, fourth time, they'll be prompted to actually do something about that. And again, we really want all different types of businesses and partners with this, not just within the healthcare industry. So retailers, Starbucks, we've named those, and we'll show you some examples of some of our partners, but in-store radio announcements, we can provide those. Bag stuffers to hand out to customers or patients, we're happy to provide those as well. I'm not going to read through all of those out of the interest of time, but we have some incredible partners that are doing amazing things in the state of Texas already, and we need more partners. Vaccinate Texas needs more partners, so we're asking you to consider joining the effort here to really increase immunization rates in Texas. We have many more smaller partners that aren't included on this slide deck, so why do we need more? Why do we need more people to help join the effort? So we wanted to call on this slide, some of you, probably most of you, are familiar with these statistics. And what we wanted to highlight here is the variance between that top state, almost 58% in Massachusetts, compared to the lowest state, which is Florida. So we're in Texas, right? So we're probably all scanning, looking for Texas, and you notice we're not there. So we're not the top, we're not the bottom. We fall somewhere in the middle. So specifically, about 44% of the Texas population older than 6 months received a flu shot in 2012 through 13. So that puts Texas about 35 in the nation. We're better than 35 in the nation. We've got to get better than that. And again, to Raj's earlier point, it takes more than just one organization. It takes more than 10 organizations. It needs all of our organizations that are represented in this room really joining the effort here and getting us where we need to be. Specifically, Vaccinate Texas is looking to really target in, and where we think we can make the most significant impact is the age of 18 to 64. And that's where we're going to really be honing in moving forward. And currently we're 38 in that group. We're confident we're on the right track, and we know it comes down to having the right partners and the right providers. I like that quote that was shared earlier, that immunizations don't give themselves, so we've got to drive people to the providers, and we need partners in Vaccinate Texas to make that happen. So we know, and research tells us, that effective campaigns bring together a number of different components. And one of that is you have to have a powerful message. And we want to proactively engage our audience. So today, our audience is you. And we're hoping to inspire you to join Vaccinate Texas. Once we leave here today and we all go back to our respective businesses, our audience becomes our patients and our customers. And we need you to help drive that bigger picture. And then the particular ask there, the call to action is, get a flu shot. Start with the flu shot and then expand services out to other immunizations beyond that. Grassroots efforts are really important. We all know that. So if I were to go around and say, who do you know, and 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 we all take that, all of our associations, and we combine those, think how powerful that could be if then we take all of our associations, we're all again driving the same image, the same communication, and we're doing it across social media. We could do phenomenal things, and we will do phenomenal things here in the state of Texas, and we want your help doing that. Vaccinate Texas also has a group that's working to educate and work with our legislators. So we have senators and representatives that are very well educated and very involved in driving healthcare, different agendas in Texas, and they are on board with Vaccinate Texas, and they blog about it, they send tweets, they write op-eds, doing amazing things via social media. They have amazing influence, and we're proud to partner with them to drive up immunization rates in Texas. We've talked a little bit about where we work. So regardless of who pays you, who writes your paycheck, Raj, you're concerned about that. But regardless of where you work and who pays you, we know that a lot of us in this room have amazing programs that are already in place in your organization. And we're excited about that. We want that to continue. All that we are asking is that you consider joining Vaccinate Texas and enrolling that into your already existing programs. So what does it look like? What are our next steps? We want to ask for more partnerships. We want to drive more partners. Particularly, we're looking for healthcare providers, but we also want non-healthcare related entities. Companies that have a large footprint in the state of Texas, so whether it's Home Depot or Starbucks, we want not just to drive the customers that go there, but think about the number of people that work for all of these organizations. So if we can improve the health of the employees of the partners within the Vaccinate Texas program itself, that in and of itself is a significant win in the state of Texas. We also want to encourage our partners to really go after driving the awareness and expanding those grassroots efforts. Again, same message, same time. We're really excited because we know that can deliver amazing things for Texas. So hopefully, but before we meet next, or by the next time we meet, we'll be sitting here and we'll have definitely moved that needle from 33% in Texas, number 38 in the country. I think we could do the top 5, right? Don't y'all think so? Top 5? We want to be, this is Texas. We're proud Texans. So let's get us up in the top 5. And to do that, it's going to take all of us. So we really appreciate your time. I know we've got time built in at the end for questions, but we wanted you to have our contact information. If you'd like to use these images and you don't know where to go, if you have questions and you're not sure where to go, we're lucky we have the subject matter expert, the creator of Vaccinate Texas is with us. Kate's here in the front row. So kate.turner@walgreens.com. Raj, again, is in Dallas, and I am local here in San Antonio. So if there's anything we can do for you guys, we're here to help. If we don't have the answers, we will get them for you and get back with you. But we appreciate your time. What an honor to talk to a group that can really make such a big, significant difference driving immunization rates in Texas. Thank you.
Thank you so much, Raj and Kayla, for that presentation. And we're just going to move forward to the next presentation in the set. If I can cue it up, that would be fantastic. Okay. So next we have Carlos Velázquez. Mr. Velázquez is the Senior Vice President of Community Engagement for MHA Associates Incorporated, a cultural communications firm in Washington, D.C. and Los Angeles. He has more than 20 years of experience in developing campaign partnerships within the public, private, and nonprofit sectors, and has provided technical assistance and capacity building services to a large network of Latino serving and other minority agencies and health departments throughout the U.S. and abroad. He's currently the project director for the Centers for Disease Control and Prevention, Grassroots Communication, and Social Marketing Campaign to promote influenza immunization, which includes the launch of the National Influenza Vaccination Disparities Partnership. The partnership has more than 600 members in 110 target markets and has coordinated 400 flu vaccination clinics in the United States and Puerto Rico. So join me in welcoming Carlos Velázquez.
Good afternoon. Buenas tardes. I'm in Texas, so I have to be able to be conversant in at least Spanish, correct? So there's my statement. I have no conflict of interest. And I know that there are evaluation forms that you all need to fill out. So I always at least make reference to the objectives, because at least you can say, did Carlos meet his objectives? Well, he at least made reference to them. So I'm really here to talk about how stories work and why they're a powerful tool to be able to talk about the importance of flu vaccination, or any kind of vaccination, really. We're going to explore the critical elements of story and best practices in storytelling, and finally talk a little bit about dissemination strategies. So I have been living in Washington, D.C. for 14 years. How many of you have been to Washington, D.C.? Excellent, so a few of you. Let me tell you that when I first moved to Washington, D.C., I was struck by how big the rats are there. And I know Texans like to do things big, but you don't want to do bigger rats. And I remember one time I was in the Latino barrio, which is where I live, and I saw this rat running across the street because he was being chased by a big old cat. And he got into a little hole, and the rat was in the back of the hole, and the cat was trying to get him and was going meow, meow, meow. And the rat was scared, but you see, rats, at least in the Latino barrio, they tend to be a little more macho. They tend to be a little tougher, and they have their chest up high. But in this case, he was a little scared. And the cat kept going meow, meow, meow. And after a while, there was silence. And then the rat heard a woof, woof, woof. And he thought, the cat got scared. So out comes the rat with his chest up high, all macho and all. And suddenly the cat grabs him by the neck, and the rat was shocked. And he looked at him and he said, I don't understand. I heard the meow, meow, and now a woof, woof. And he said, in this neighborhood, if you want to survive, you gotta be bilingual. And I think that's true in Texas too. So I tell that story, and if anything, you may not remember anything I said, you may not remember the objectives I had, but you'll remember the meow, meow, woof, woof story. So traditionally, Latinos, African Americans, and American Indians have really gravitated to storytelling as a way of being able to not only honor their culture, but as a way of sharing their values and beliefs. And today, we live, of course, the digital age, and everything is shared immediately. How many of you have been tweeting here at this conference? So a few of you, excellent, excellent. We'll have to retweet whatever you have out there. And the important part here is that stories are able to help shape reality. They're the way that we make sense of the world. And there's a lot of research that shows that narratives are used as a way of being able even to allow us to reflect on our lives and our health practices, and are a powerful tool to be able to edit our own sense of self. And so we look at that in terms of the ability people have to be able to put themselves in the shoes of the other, the persona that is created, the decisions that are made, and the possibilities, especially healthy practices that come about through some kind of transformation. And so there's an interesting book that just came out by Eula Biss that I think is worth investigating on immunity. And her whole premise is that we as individuals constantly use metaphors as a way of being able to understand ourselves and the world around us, just like stories do. And her premise actually is that we are constantly using metaphors to talk about who we are, our world around us, our families, our loved ones. And so think about it. We constantly use metaphors. But more importantly, we also use a metaphor to separate ourselves from other people or situations that are difficult. And think about how we make reference to vaccinations. We think about as a flu shot. Shot has a negative connotation, right? And as pharmacists, you probably have seen plenty of people who are really hesitant just because they're afraid of needles. And one of the things I've always noticed, because we take a lot of photos throughout the country of the flu vaccinations that we do organize with Walgreens, and in all those photos I've been looking at, there seems to be some consistent pattern that when men are getting vaccinated, they rarely look at the vaccinator or at the needle. Am I right? And yet the women, they're a little tougher. But the important part, too, is that the women are often the ones that make sure that the men are encouraged, but often will not get vaccinated, the last ones to get vaccinated. The other thing I wanted to point out here is that it's interesting in Great Britain, it's referred to as a flu jab. Again, another negative connotation. And we look at what Susan Sontag wrote a few years back as a theorist in relation to cancer and AIDS and the kinds of metaphors that were used in order to talk about and stigmatize people who were living with HIV. And so it's important not only to look at metaphors, but the way that we actually then create that vehicle, which is the story. And they're passed on. Think about your own lives as children. Did you participate in jump rope rhymes or hand clap songs and rap songs and histories or creation stories? Think about it for those of you who are Latino or understand this particular practice, the cuentos that your abuelita shared with you, your grandmother shared with you, or the dichos. There's one that's one of my favorite, and many of you may know it. Mejor solo que mal acompañado. Better to be alone than in the company of someone you really don't want to be around, right? And so those are things that we take with us that make sense for us and that we then share with our loved ones. So here are the essential elements of a story. There has to be a sense of passion. There has to be an emotion. And some of you have these postcards that have Un Amor Perdido. And this is a motion comic book that we created that we wanted to use as an app because we were told by promotoras or lay health workers that they're tired of carrying paper, brochures, fact sheets, papeles. They're heavy, and you have to go out into the street in the fields. So they wanted something that they could actually use on their smartphones. And it's proven to be quite useful for these workers. The other thing that was important is that we need to have a hero or protagonist, and then a villain or antagonist. And it's the most essential element of any story. There has to be a conflict. A sense of awareness has to emerge and some kind of change or moral to the story. So I make reference to this real story that actually happened in Albuquerque. And this was for NIVDP last year. And there was a Navajo couple that really distrusted the idea of having any kind of foreign matter enter their body. And so the nurse had to explain the benefit of flu vaccine. And they were still a bit hesitant. So the nurse said, well, maybe you can overcome the fear by holding hands and getting vaccinated at the same time. And that's what she instructed them to do, and that's what they did. And so we have the young fearful couple, which is the protagonist. We have the misconception and fear, the antagonist. We have the conflict, the challenge of getting vaccinated, and the awareness that was brought about by the nurse, and the transformation that happened. And the moral of the story is that love conquers fear, and they got vaccinated and protected. And the story actually went viral, and it was shared throughout the Navajo Nation, and it stuck very well. People, really resonated well with the story. The other thing that's important in terms of actually creating stories that stick, there has to be some kind of likable character. There has to be some kind of cultural value that's important. And there's got to be an important moment where the person can actually reflect upon how the story relates to them. And I point this out to Pinocchio. And how many of you remember the movie Pinocchio? So a lot of you. And I love Pinocchio as a movie, but Disney is very careful about the way it creates its storylines. And it's really telling of how universal a story can be like Disney creates. And there's a story that I heard of a young man who was in elementary school that decided to create a support group in his elementary school for differently abled children. And so they would actually sit after school and watch Disney films. And then they would have discussions about how does this movie relate to you and what did you see in this film? But what's fascinating is that regardless of the disability, whether it be a learning or a physical disability, the children were engaged and they were able to talk to each other and be children. And one child was asked, what's your favorite story of Disney? And he said, Pinocchio. And he said, why? He said, because Pinocchio, his only dream was to be a real boy. And that's all I ever want, is for people to see me as a real boy instead of just someone with Down syndrome. And I heard that story, I said, that's amazing. That something like Disney and Pinocchio could really reach a young man whose reality was so different. He just wanted to be like a regular boy. So in looking at the piece that we've developed for Un Amor Perdido, we were very careful in designing it for young adults. We had the characters, the pregnant mom, the loving father, young daughter. And it is a tragic story, a real story that happened after H1N1 hit LA pretty hard. And the mom who was pregnant didn't follow her doctor's orders to get immunized. And unfortunately, she became quite ill. And at the end, she dies. And of course, she loses the baby at the same time. And so it's a very tragic story, but one that really resonated well with Latino audiences. And I want to quickly go through some dissemination strategies that we've used with our campaign that have worked very, very well. So the most important part here is that you always have to think this. The audience comes first, because whatever you do, you're doing it for an audience. But the other thing that I'm going to tell you is mobile comes first. That it's really critical that whatever you create and whatever design or approach you take, you need to think to what extent is it mobile responsive? Because that's what young people are using all the time. How many of you have kids that are, young and always have their faces in their phones? It's their reality, right? And so just looking at sort of the differences in terms of social media practices, logging in once a day or more often in terms of the different cultural groups. Hispanics use Facebook quite a bit, African Americans, and you can see what's happening here. They over-index in relation to social media practices, whether it be Facebook or Twitter or Google+. The other strategy that we use quite a bit is engaging Latina mommy bloggers. And I would really encourage you to reach out to these bloggers because they have a captive audience. And women talk to other women. Women will listen to other women, especially when it comes to pregnancy. So the fact is that we're able to fit in messaging that's very strategic, and we use subject matter experts as a way of getting messages out to mommies is really an effective tool. We also have our Facebook page for our partnership. And so there, I would encourage you actually to visit our Facebook page, which is the National Influenza Vaccination Disparities Partnership Facebook page. And I have no problems with all of you getting on your smartphones because I actually have a nice little gift for the fifth person in the room who likes us. So the fifth person who likes us, I have a nice gift for you. But we found out, though, in using Facebook is that people like to be thanked. And a lot of times, there are two reasons people don't act. One, they're not asked. And secondly, they won't do it again if they're not thanked. We found great power amongst our partners when we publicly thank them. And it's really important. So we do that in a variety of ways. We have special recognitions, special events for our partners, but we also then engage local health officials and elected officials locally. So a proclamation might be declared. And so that's one way we've been able to engage, at this point, 90 different mayors throughout the country that have been able to sign off on a proclamation that has now become official policy with the U.S. Conference of Mayors. And so it's one way of being able to say you're part of a national campaign. The CDC thanks you for all the hard work. They love to be thanked publicly amongst their peers. So we are creating this sense of community online. The other thing that's interesting is that we're able to see messages that come from our partners as a way of being able to gauge when outbreaks might happen. Conversations begin to shift. And that has actually helped us plan out with the Walgreens staff in relation to, we start seeing, you know what? We may need to have more vaccination clinics sooner than later because we're starting to see some interesting dialogues online. The other piece that we created that's been very popular is our influential news, our e-newsletter. And we published 41 articles this past season. And on average, we have about 1,000 clicks per month and about 100,000 instances on the CDC website to the e-newsletter. And what's interesting to me now is that, at least working within Indian country, that we have learned that there are a lot of interracial marriages. So when we put out our newsletter in Spanish in Indian country, it went like wildfire and actually surpassed the number of clicks from the Latino community. So that tells us that there is a scarcity of resources in Spanish within Indian country, and there is an audience. So we learned a lot about that. And so here's some of the results. That we went in the first year with NIVDP, we had 43 media partners, and it went now to 148 media partners. We had 39 media placements, and now we had 152 media placements, and it translated to 120 million media impressions for the last NIVDP. And this year we're doing it all over again, December 7th through the 13th. So we'll be very, very busy. So the take-home message is clear. That stories are a way of being able to create emotional connections with your target audiences. That stories have the potential of promoting healthy behaviors, and that they can influence a personal narrative or how they see themselves. It's important to use cultural values as a way of making sure that they resonate well with the audiences. And finally, that stories can actually help sustain partnerships especially if you use stories as a way of being able to thank them over and over again, to find recognition for them, and being able to find some kind of incentive for them to be able to carry on with the partnerships. And with that, I can tell you that stories have the potential of saving lives. Remember to like us, and if you have any questions, I'll be more than willing to answer them.
Thank you, Carlos. So at this time,